Hello, I'm going to talk to you about the technology used in acute elderly inpatient care and its effect on the service. So, what is assistive technology? Assistive technology is technology that aids and improves quality of care and is used in lots of healthcare settings. Specifically in acute elderly inpatient care, assistive technology is used in improving the service by reducing the risk of injuries to both service users and healthcare professionals. It makes care easier and more time effective. It also makes transfers a lot safer and has reduced the risk of injuries to service users. Assistive technology is used by occupational therapists during treatment. For example, when an occupational therapist transfers a patient from chair to bed or bed to chair, it allows them to do this more easily and reduces the risk of injury to both the patient and the occupational therapist. So along with assistive technology, there are also technological transfer aids. So these are used by the nurses, to change the patients, to get them up and dressed. They're also used by the OTs in treatment, because a lot of service users have very complex needs, meaning that they might not be able to manoeuvre around properly, so they might not be able to receive the right treatment if they're not transferred into certain chairs and things. So they'll be used by occupational therapists and other healthcare professionals in transfers. So as I said before, they decrease the risk of injuries to healthcare professionals and service users, as a lot of older people are frail and can be injured a lot easier. As well as safely manoeuvring them, it puts patients at ease, meaning that therapeutic relationships can be built easier, and that there is much more trust between the healthcare professional and the service user. Physical aids are used by lots of different healthcare professionals. They are used by OTs, nurses, and physios. Technology in general has improved, and this means that service can be delivered faster through new treatments, new technology which aids in getting patients discharged faster. So one piece of technology that is used after discharge is a falls alarm. So falls alarm mean that if an elderly person falls while they're at home after discharge, they can use this alarm to alert their carers that they're fallen. It gives elderly people a lot of confidence at home, as they have the help if they need it. Another piece of technology that might be used at home is a stair lift. This might be introduced so that elderly people can get up and down the stairs more safely, and it also reduces the risk of them falling and coming back to hospital. One of the effects of this is that there might be more beds at the hospital because less people are falling, therefore there's more beds available. So over the past 20 years, computers have been introduced into healthcare, and they've had a big impact. So System 1 and the intranet have been both introduced, and are both used to safely and securely transfer information over a private network. So they both aid in communication, as they both allow different healthcare professionals to interact with each other and send emails and private messages about patients. System 1 specifically is used for patient notes, and it allows multiple different healthcare professionals to add to the patient notes and their caseloads. So System 1 and the intranet both improve patient care, as it makes the service more effective and more efficient, meaning that patients can come in and out of hospital faster.